My name is Pat Cooper. I'm 62 years old and I live in Granbury, Texas. One of the reasons we moved to Granbury was to be able to enjoy the outdoors, being able to enjoy nature and the animals and everything else. The pain in my hip started probably back a couple of years ago and I was diagnosed with osteoarthritis in the right hip. So the pain was uncomfortable and then steadily got worse over the years. I would go out and work in the garden, but then I could hardly move that night. September is when I started having it increased to the point where I couldn't walk, and my son was getting married the end of November. I was going to be there no matter what, but am I going to be in a wheelchair? Am I going to be in a cane? And am I going to be able to dance? Am I going to be able to celebrate?
Her cartilage has completely worn out. It's bone on bone. So on x-ray, you can see essentially her femoral head is rubbing against her acetabulum, her hip socket. She has severe joint space narrowing to the point there's just no space at all. You can see bone spurs throughout her hip as well.
So it became quite evident that I needed hip replacement. It was a complete hip replacement, so with that comes a recovery time. You would anticipate that you got to take small steps at a time as you progress, but the pain was gone.
At Texas Hip and Knee, we like to focus on personalized care. Everybody needs something differently. Everybody's anatomy is different. Goals might be different. Diagnosis might be different. For total hips, I focus on different approaches for the patient, whether it's direct anterior, lateral, posterior lateral, you name it. We also use robotic surgeries. We also do minimally invasive. So we have all the latest and greatest technology available for the patient. We make that decision with the patient and talk about the pros and cons. Texas Health Clear Fork, we have several team members involved with taking care of the patients and coordinating this care. Our joint coordinator especially is helpful.
The work that the joint coordinator does is instrumental in helping patients prepare for what they need to know prior to surgery, what they need to know for surgery, and what they need to know for discharge.
They were very informative. They had educational classes for you to take so that you could be aware of what to expect going in, how to prepare ahead of time, how to prepare afterwards.
Texas Health Clear Fork is an amazing facility to have your hip and knee replacement done. The hospital essentially focused just on hip and knee replacements. So we're able to focus on the patient getting well, focus on recovery, the equipment there, the location, everything allows for a seamless process.
I am now able to do everything that I love to do. So we can enjoy the outdoors, I can enjoy my gardening, I can walk again, I can hike again. The best part of that was that I was able to participate in my son's wedding and be able to dance with him.